Hi, I'm Dr. Geoffrey Van Thiel. I'm an orthopedic surgeon with OrthoIllinois. I specialize in sports medicine and practice out of our Rockford and Elgin locations. Femoral acetabular impingement is a very fancy way of saying that the ball at the top of our leg bone that sits within a cup is bumping up against that cup. This can occur because of overuse. This can occur because of how those bones are formed. Essentially, when that ball bumps up against the rim of that cup, it's impinging on that cup, and it can lead to pain, it can lead to weakness, and it can lead to dysfunction of the hip. So femoral acetabular impingement is nothing more than saying that that ball inside our hip is bumping up against the edge of that cup. Some of the causes of femoral acetabular impingement can really be put into two categories. One category is just how we were made. Sometimes that ball that bumps up against that cup, if it has a small extra bump on it, or maybe it isn't completely round, it can cause extra pinching up against that cup, leading to femoral acetabular impingement. The second cause is really just use of the hip. In some people, they can get their hip into positions, or their hip will go into a position where even though their ball is round, it still bumps up against the edge of that cup. During femoral acetabular impingement, we can also have some pinching of something called the labrum. That impingement, which is pinching on that labrum, can cause pain in the hip as well. Treatment options for femoral acetabular impingement typically follow a stepwise progression. And the reason for this is because femoral acetabular impingement is not necessarily causing more destruction or more damage in the hip. That first step is usually anti-inflammatory medications to reduce some of the inflammation in the hip, as well as physical therapy to strengthen the core and help rotate the pelvis into a position that reduces the amount of impingement. The second step is when we start to discuss possible injections, either injections into the hip or around the hip in order to reduce the inflammation and improve function. And the final step is when an individual has not had any relief from those earlier steps, we then have the ability to move to a hip arthroscopy, or a surgical treatment where we can go into the hip with a few poke holes and reduce the amount of impingement and repair any damage that impingement has occurred.